Sleeping sickness, or human African trypanosomiasis, is a deadly life-threatening disease, yet it remains neglected. Although the disease has been close to elimination several times in the last century, it has stubbornly refused to disappear. Each year, a few hundred cases of sleeping sickness are reported to the World Health Organization. However, many cases are not recognized or reported, and the true number of new cases is higher. 5.6 million people live in areas at moderate to very high risk, and tsetse flies are present in 36 African countries, posing a ticking time bomb. What is sleeping sickness and what causes it? Sleeping sickness is caused by parasites transmitted by infected tsetse flies and is endemic in 36 sub-Saharan African countries where there are tsetse flies that transmit the disease. Human African trypanosomiasis takes two forms, depending on the subspecies of the parasite involved. Trypanosoma brucei gambiense is found in 24 countries in West and Central Africa. This form currently accounts for 95% of reported cases of sleeping sickness and causes a chronic infection. Trypanosoma brucei rhodesiense is found in 13 countries in Eastern and Southern Africa. Nowadays, this form represents under 5% of reported cases and causes an acute infection. Are there other ways one can get sleeping sickness? Yes. An infected mother can transmit the disease to her unborn child when the parasite invades the placenta. Recent studies have also found out that sleeping sickness may be transmitted through sexual intercourse. What are some of the signs and symptoms of sleeping sickness? The first sign is from a bite by the tsetse fly, which is often painful and can develop into a red sore, also called a chancre. Fever, severe headaches, irritability, extreme fatigue, swollen lymph nodes, and aching muscles and joints are common symptoms of sleeping sickness. Some people may also develop a skin rash. Progressive confusion, personality changes, and other neurologic problems occur after infection has invaded the central nervous system. If left untreated, infection becomes worse and death will occur within months. A person infected with Trypanosoma brucei gambiense can be infected for months or even years without major signs or symptoms of the disease. When more evident symptoms emerge, the patient is often already in an advanced disease stage where the central nervous system is affected. Does sleeping sickness have a cure? Yes. Fexinidazole is the first all-oral treatment for both stages of T.B. gambiense sleeping sickness, the most common form of the disease. Fexinidazole was developed by Drugs for Neglected Diseases Initiative and partners, and at the end of 2018 it was recommended by the European Medicines Agency for treatment of both stages of gambiense sleeping sickness. Fexinidazole oral pill is taken for 10 days, offering significant advantages over the previous standard of care. What should I do if I think I may have sleeping sickness? If you suspect that you may have sleeping sickness, immediately consult with your healthcare provider, who will order several tests to look for the parasite. A skin biopsy may be done if you have a chancre. Blood tests will be done, and a spinal tap may also be performed. For more comprehensive information, grab your copy of Health Magazine today.